we have created a framework in some sense of prioritization. Again, this is similar to what a number of other jurisdictions are utilizing, and in some instances have publicized. Baltimore City publicized a similar framework on yesterday and is available on their website, and ours will be available on the website that Dr. Stoddard mentioned in his opening remarks. And so priority group 1A, I'll go through these quickly as this information will be on the website to leave time for questions. Again, here are the groups that are covered within that category. Next slide. And we are continuing priority group 1A tier 1, and we're also, all of the doses that we have administered so far in terms of the county apparatus have been a part of priority group 1A and tier 2. And this includes emergency medical responders, folks who are part of the vaccination team, testing team, the COVID response team, and we've prioritized primary care offices and urgent care offices with the understanding that if an individual is COVID positive, particularly if they're symptomatic, they're likely to seek care and treatment in those facilities in addition to the hospitals, either through the emergency room or if they're hospitalized, they would receive treatment there. Next slide, please. Now, this is the group, we're not quite there yet. Hopefully we will be there very soon. That includes other providers. Again, we recognize that there are other providers who are also at risk. And here's a list of those individuals who would fall into priority group 1A tier 3, including dentists, pharmacists, other healthcare professionals in outpatient specialties, in-home nursing staff, community health workers, optometrists, etc. Also moving further down into the first responder pool, including staff in our shelters, as well as our corrections facilities and other law enforcement. Next slide, please. And again, this is a continuation of other individuals who we would consider in the group 1A tier 3 group. And again, we are hopeful that we will be able to move forward and increase access to the vaccine in the very near future to these different cohorts. Next slide. Now, after this group, we would move to group 1B, and the tier 1 group within that is prioritizing adults who are over the age of 75. Next slide. Tier 2 would include other frontline essential workers, particularly those where they cannot telework. They are coming into frequent and potential exposure to others in their workspace and the public. And here's a list of individuals who would be included in that. Next slide. And then when we transfer over to 1C, the tier 1 group within that would be individuals over the age of 65. Tier 2 would be individuals who are ages 16 for the Pfizer vaccine and 18 for the Moderna vaccine to 64 who have different medical conditions that could put them at risk for a severe case of COVID-19. And that will be spelled out further, including a list of potential health conditions included within that consideration. And then tier 3 within that would be other essential employees who are not covered in the priority groups 1A and 1B.